Ladies and gentlemen, welcome to the OrthoFit podcast. Whether you're a seasoned athlete or just getting started on your health and fitness journey, I'm honored to have you join us today. Prepare yourself for an enlightening discussion with Dr. Jeff Kunze, a doctor of physical therapy, owner of a cutting-edge mobile PT business, and a true authority on injury management. Without further ado, let's dive in because this episode is full of valuable insight as we explore the nuances of identifying and accessing the highest quality physical therapy services. Hey Jeff, thanks for coming on.
Yeah.
Good to have you.
Yeah, for sure. No problem.
How's everything going, buddy?
Good. Things are great, man. Just grinding away day by day.
Yep. Life in the PT world.
Yeah.
So can you tell the listeners a little bit about your PT background? Like what experiences do you have? What kind of settings have you been exposed to and things like that in the PT world?
Yeah. So I received my doctorate in physical therapy in 2015. So I've been practicing coming up on a decade now. Primarily in outpatient orthopedics. So I've been in the busy clinics, in the grind of booking every 20 minutes to being able to see a patient every 1 hour. So kind of been in the spectrum of care within the orthopedic realm.
Gotcha. And we'll get into a little bit about what differences that maybe you've seen between the 20-minute sessions and the hour sessions.
Yeah, definitely.
And what setting do you practice in currently?
I currently do outpatient orthopedics still, but we've developed a mobile version of that. So we go to people's homes, workplace, treat kids out on their sports fields, kind of wherever they want us.
Awesome.
So it's unique. We've had to utilize our own environment and stuff and not have the typical clinic setting with weights and all these different things.
So getting a little bit creative with what you have around, what can we use for this? What can we use for a weight or for a step or things like that? And I think that's good too, because you can kind of see what people have access to at home. A lot of times people go to a clinic and they might not have the Alter G at home or a leg press machine at home or a reformer at home and stuff. So we want to, of course, help people know what they can do on their own so they can keep up making progress and keep improving for a long time. So it's probably a unique advantage, would you say, to be able to see someone's natural environment?
Yeah, I mean, again, you start learning things through your career, right? And one of the things I've learned is it's not necessarily what you're doing in clinic, it's the habitual changes you get with people. They have to make some changes at home, and being in their environment, we've seen more compliance with home exercise programs.
Oh, great.
That kind of stuff. So yeah, I think there's a lot of benefits to it for sure.
That's awesome. So I wanted to chat with you a little bit today about what quality physical therapy looks like, because that might be different in different settings, and help the listeners know if maybe they're going to a new clinic and they're not sure, they're kind of feeling it out. Maybe one of their loved ones had a problem and they're watching them go to physical therapy. How do they know that they're in the right spot where they're going to be getting good care? So let's start off with what is good physical therapy care? It's kind of a weird question.
It's a tough one, right? Because you and I have had so many conversations of, we all treat differently. You put 10 PTs in a room and we all would approach, a patient quite differently, right? Yeah. You and I align somewhat on exercise-based intervention, but I think two of the things I would look for if I was bringing a parent to a clinic are probably time spent directly one-on-one with the PT. And the second one, if that PT is willing to offer education. That's the biggest gift that I think a patient can get is to become autonomy, right? It's learn what they have to do and then be able to help. PT should be there to help implement this plan, right, for the person to do on their own. Right. And so those are probably the two biggest things I'd look for. What do you think? Just curious what you think the typical clinic looks like nowadays.
It's tough because, I've managed some insurance-based clinics in the past, and what we see from insurance is, not only are the rates not the best, but it's also a flat rate for a lot of insurances. That means no matter how long you spend with the patient, you're getting paid exactly the same. So what is there from a business or productivity incentive to be able to go above and beyond for someone when no matter how much time you're seeing them, you're getting paid the same amount?
Yeah.
I think if you think, and now this might not be the best, we're talking about human beings, but from a business owner perspective, if you're getting a flat rate, then the best thing to do is see more patients per hour, right?
Yes, definitely.
But what has to happen in order for you to see more patients per hour? It's either the quality goes down or the thought process goes down or the face-to-face time with the therapist goes down, or maybe patients are just using machines more and they're not spending that time with the therapist getting one-on-one hands-on treatment or personalized treatment. So it can be tough because most people, they use insurance for physical therapy because it makes it a lot cheaper than you go to a clinic and you might only get, I've seen some insurance clinics that you're getting 30 minutes with the therapist. I think that's a reasonable compromise, but I've also heard of ones where you're only getting 10 or 15.
Yes.
And then the rest of the treatment is being done by an assistant or an aide. It's not even from the therapist itself. And that's if you're not just bouncing around to hot packs and cold packs and machines and stuff like that.
Definitely.
So it's really tough because then someone will say, well, I went to physical therapy. It didn't work for me, right? I guess I'm unfixable, right?
Yeah.
Usually I think if you go to a talk therapist and then you're like, oh, it wasn't the right fit for me, I got to find someone else who is the right fit and keep trying to find a new one until we get there. But for some reason, some people who haven't had a lot of physical therapy, they might think that we all approach things the same way. And if it doesn't work, that they're not going to get better. It could be that they needed a different approach, or it could be that they needed a little more individualized attention.
Definitely.
And that's where I think the insurance model runs into problems. Now, for a lot of people, they just need some simple exercises, a little bit of reassurance, and you don't need a straight hour in order to get those kind of things.
Yeah.
For those people, it's fine. But for the people who try it and don't get better, they might need some more individualized attention, I think.
Definitely. And I think you brought up a good point, is not everybody needs an hour either, right? So I think the problem is that sometimes with that number of patients, we become very cookie cutter, right? We've talked about this term cookie cutter with exercise intervention or manual intervention, whatever we're doing, it's cookie cutter. And I think limiting the time makes it even more cookie cutter, right? You're trying to squeeze everybody into a 15-minute segment, and a big percent of the population does not fit in that 15 minutes, right? But like if you have an hour, maybe some of the patients you're spending 30 minutes with or 20 minutes with because, they're the engineer type that just, I want instruction. There's no emotional component to it. Like, give me my exercises. I will do them. Just show me how to do them. But there's a lot of people that aren't like that. There needs to be some more time spent on anxiety, mental health, stress relief, different things. And I think those people having the ability to expand that time into an hour is very beneficial.
Right? You're not just doing a checklist of exercises, but you're looking at their stress management and their lifestyle and how healthy they are and their beliefs and understanding about what's going on.
Yeah.
And just like if you give everyone an hour, you're going to overtreat some people, but if you give everyone 10 minutes, you're not going to get enough. And that doesn't leave a lot of time for trial and error. You know, if someone doesn't get better, I want to try to be a detective and figure out what's going on. And that's not always a linear process. Sometimes you need to try different approaches. It's kind of insane because if you do the same treatment for everyone, you get different results. And to get the best results, you have to give different treatment to everyone.
Yeah.
But if you're only spending 10, 15, 20 minutes with the patient, it saves mental energy from the therapist to just treat off of a protocol. But then you're not individualizing the care. And we know that everybody's body is individual. Like there are certain rules and patterns and anatomy that's the same in everyone, but there's lots of biological and psychological things that are different between different people. And I think the therapists may just kind of do the cookie cutter programs to save energy, but then they get a little burnt out. So I used to work in a setting like that, and now I'm seeing patients for longer, so I'm able to go in a little bit more depth, and I try to think of it like a puzzle. Like I need to find the right combination of approaches and treatments for this person to help unlock their true potential.
Definitely.
And that's going to be completely different from someone else, even if the diagnosis is the same.
Definitely. So I guess the tricky part is for somebody that doesn't have experience in navigating this and seeing this, is how to be able to navigate that with a clinic, right? Like are you going to call them and ask, are you going to pay attention to me, or are you going to get, so, that's a tricky thing. I think the best indicator again is time spent one-on-one.
Yeah, absolutely.
But it is going to be a tricky thing. It's almost like, educating the patient on understanding that if you do try something and it doesn't work, and the therapist is not willing to budge and try something, to go search for somebody that works for you. Like again, PT is not a created equal. It's very different, and you put 10 practitioners in a room, they're all going to have a different approach. So I think one of the lessons is maybe to try it. If it doesn't feel right, don't be, scared to or hesitant to go somewhere else.
Try something else.
Yeah.
And a lot of times it could even be the same place, but a different therapist, right? Even people who I went to school with and they're my friends, I still treat differently from them because no two PTs treat exactly alike. We've different courses, experiences, just we notice different things when we're working with the person. So if anyone out there, if you're going to see a PT and it just doesn't feel right, you're not sure if you're getting what you need, just try someone else. You know, we won't take it too personally, but there's a right fit for everybody.
Definitely.
So I think, and that goes for a lot of things, you know, whether it's a talk therapist or a physical therapist or even like your diet, like there's a different one for everybody.
Yeah.
And if what you're doing isn't working for you, you know, give it a fair shot. And if it's still not working, try changing it up a little bit.
Yeah.
So if you're gonna, let's say, because all the time when you're a physical therapist, people say, oh, you know, you're a physical therapist, you know, I have this issue, or my mom, my dad just had this procedure done, my grandma's going to this clinic for her, this or that. So let's see if we can give the listeners like a little bit of maybe like a checklist or at least some questions to ask. So if one of your loved ones says, hey, Jeff, you know, I just started going to this clinic for my blank, you know, it sounds like the first thing you might ask is like, how much FaceTime are you getting with your therapist?
Yeah.
What else do you want to know to see if that's going to be like a good place where you can give them your blessing to keep going, or if you're going to suggest that they might try something different?
You know, it's tricky. I think time spent in the education process are like the two main factors. And then I think at that point, personally, my opinion would be to dive in. You got to try it, and you can learn a lot from the initial evaluation. I think to me personally, how I conduct my initial evaluations is I spend a lot of time on the subjective report. I think you get a lot of information from the subjective report. And, you know, the objective measurements is important too. I know you're heavily based in like research. I'm somewhat based in research, but I like trying some different things. But and I know that's another conversation.
For sure.
I think you know, somebody that's going to sit there and listen to you and kind of hear what your mechanism of injury, your whole medical history, past what you've been dealing with, again, not just physically, not everything is mechanical, right? There's so many other factors that come into this, like sleep patterns, stress levels, diet, like so many factors that you really need to dissect some of this. And so I think getting a good idea of what that clinic's going to offer is in that first evaluation of like what they're kind of diving into. If it's, it's a shoulder issue, I'm going to just look at that shoulder, you know, do a couple shoulder motions and that's it, and then let's get treatment going. I think it's falling short of overall health and what might be causing it.
I have a big smile listening to you. I'm just so glad you said that, because I'm huge on like listening and communication skills with patients. Everyone can learn an exercise, or as therapists, we can learn how to mobilize a joint or a soft tissue or do an exercise. But you can get so much of the information from just simply listening to your patients. It's going to make them feel more heard. It's going to make them feel like they can trust you because you know what's going on. It's going to make them feel like you care. And then even though we're physical therapists, patients tend to know their body the best. Patients are remarkably accurate and intuitive when something is going on with their body. And so I completely agree. You get so much of the information you need. You can almost diagnose many people just based off of their subjective like report, just by chatting with them.
Definitely.
And then you also know what kinds of things are the most important for them. You know, maybe someone really wants to be able to do a certain activity and their pain is holding them back. Maybe we think they want pain relief, but really they just want to know that they're not damaging themselves. Or maybe they just want to be able to do a recreational thing or play with their grandkids or whatever it might be. And a lot of it comes from listening. So you know, good therapy is not about knowing like the more advanced techniques that you can do to someone. I think it's really about aligning your goals with what the patient's goals are. So you guys you have an alliance and you're working toward the same thing. So that's one of my first questions, other than the FaceTime is huge, and going along with the FaceTime is, do they really listen to you? Like, do they ask questions and then give you a chance to answer before they jump to the next thing? Or do they just say, you know, does the pain go in your leg? Yes or no? Are you having this symptom? Yes or no? And they try to get through it as it's a checklist. Exactly. So I think you can tell a lot just from your first meeting with the therapist. Like, do they ask you questions and give you a chance to say whatever is on your mind, or are you in a hurry to get out of there as soon as possible? And do they look at what is most important to you? Like, what do you really want to get out of the treatment? You know, what are your personal goals for therapy? I think that's where a good therapeutic alliance starts.
For sure. And that from what it sounds like, that happens in the initial evaluation, or if you do have somehow like a consult with them, that's the only way you're going to really be able to tell, because you're not going to go to the front desk and say, are you guys going to listen to me? It doesn't work that way. So, you know, there is some trial and error with this stuff, like any practitioner. And this goes across the whole scope. It's not just physical therapy, right? Like chiropractic, we get these, you know, I have people ask me all the time, oh, do you believe in acupuncture? Do you believe in chiropractic? All this stuff. And I'm like, look, you need to find the right, you need to find the right person at the right time to support you in the thing
Right.
you're going through. And like, that to me is the number one factor. And all these things we've been talking about go into the right person at the right time, right?
Absolutely, yeah. And if you guys want to know our thoughts on acupuncture and chiropractor, be sure to stay tuned for another visit, because we'll be getting into that and what the research shows. But yeah, so I would say, so first is like, how much time are you spending with the therapist? Are the treatments all being done by assistants or the therapist? And so how much face time are you getting with them? And then do they really listen to you? Do they give you a chance to really say what's on your mind? And then, so beyond that, like if you look at how somebody spends their sessions when they're there, do you ask them about that? Because I'm always asking, like, what does the therapist do with you when you're there? What are you working on? How do they have you spending your time when you're in therapy?
I do. I think it's crucial for somebody that's already been through therapy before to dissect that a little bit, because you can learn a lot about what works for them and what doesn't, right?
Yeah.
Like we've talked a lot about the passive modalities, how there's not a lot of science behind backing that. But if somebody comes to me and says, I went to therapy and everything I did, nothing worked except for that ultrasound for 5 minutes, and their pain went from a 9 out of 10 to a 4 out of 10, right?
Uh-huh.
I'm like, okay, as much as I don't agree with that modality, if I can bring their pain from a 9 to a 4, and then I can do stuff with them that I think is going to work and help,
Right.
I would use that, right? So
Sure.
I think you can dissect, again, somebody's past and their experience to learn a little bit more about that. So I think that is an important thing to go through. Now, my judgment of those treatments, I try to leave that out, because, again, I think you throw 10 therapists in a room and we all treat somewhat differently, right?
Mm-hmm.
So I do have my own biases. I do some manual, but I am very exercise-based as well, kind of like you. And so I'm biased towards strength training. But, again, I really try to listen to the person and what their needs are versus throwing exercise. Because I get into my own biases too. Like, I'm going to load.
Right.
Loading is going to cure everything, right? But it's...
Like, well, but I'm in pain.
Right?
It sucks to work out when you're in pain. You can't push it. You don't feel good working out when you're in pain.
Exactly.
If you can do something, even if the pain relief is temporary, you're going to feel so much better moving around and exercising. And if you can use that as like a bridge for the first few weeks, then when the pain's lower, the effects of the exercise are going to start to take hold. Because you don't make any permanent adaptations to exercise in the first few weeks. You got to be consistent. I think a lot of those other things can help make people more comfortable and buy into the exercises and feel better doing the exercises. Then they can push the exercises harder because they're just limited by fatigue and not by pain.
Yeah.
Then they do that for a few weeks. Now they're stronger and fitter and they got a lot of blood flowing, and they might not need those other things anymore. But I think it makes sense to use some of those things. This is something that's been on my mind a lot, is like, how much do we let patients drive the treatment and how much do we try to influence them? Because you don't want to do an uphill battle and disagree with the patient about everything they need right from the start.
Yeah.
I also don't think we can just kind of roll over and let the patients just say, oh, massage me for the whole hour and then I'll leave and then not do anything else. There has to be a little bit of a give and take with the therapist and the patient.
Definitely. And I think that comes back to not going with a cookie cutter approach, right?
Yeah.
You need to talk to the person. There's going to be people that are really strong-minded, and that comes with the patient or the PT being skilled with education, right? Of like really defining like, hey, Bob, like, I know you really don't want to do this. This is why I think it might help. And like, these are the benefits you might get from it. This is the science behind it. Yeah. Can we try something this? Can we modify a little bit and try that it fits your needs?
Yeah.
So I think it's, again, this collaboration. I think that's what's left out. I see it all the time with PTs, especially because, more knowledge is more power. So we just think we know everything.
Right.
And it's like kind of barking down orders of, this is your treatment plan. And I think that's not, I think it's
we're
detrimental.
working with real humans too, not isolated studies. And a lot of studies, the treatment is done in isolation or it's done in combination with usual care. But as we just said, usual care is different for literally every therapist you'll ever meet. Usual care is not just one thing.
Definitely.
So it all depends on context. So I think using those things, first of all, I would phrase them as like an adjunct. I don't want a patient to come in and I crack their back and they leave, or come in, I do ultrasound and they leave. But it's, if you tell someone, I'm going to put your back into alignment and that's going to fix your problem, and then you keep doing it, they might be dependent on that. Now they're going to be like, I'm afraid to do my deadlifts until you put me in the right alignment first because I don't want to get hurt.
Definitely.
If you just tell people, I'm going to do something to relax muscles or decrease your pain sensation or help decrease stiffness so you can feel more confident to move around that body part. Then once they start loading it through exercise, they might get more confident. Well, my body part can support me. I guess it's not as torn or broken or fragile as I thought.
Definitely.
And then they can kind of wean off the other treatments. Whereas you tell them you're putting something back into place, and they might be afraid to move or load until you put it into place first.
Definitely.
So it's not necessarily just do they do this treatment or not. It's like, what is the education around it?
Yeah.
And are those things being used to support some kind of movement intervention, or are they being used in isolation and then you leave?
Definitely.
So that's definitely something I want to ask is like, how much of the session are you spending on modalities, right? Does something really need a hot pack and an ice pack in the same session?
Yeah.
Is that tissue both too hot and too cold at the same time?
Yeah.
Or are these things where you're on a hot pack and you're sitting there unattended for a few minutes, and then you're on a cold pack and you're unattended, and that allows them to see someone else while you're sitting there?
Well, I think that's a great thing to bring up for, the patient base listening to this, because we've been in these busy clinics, right? And like, I have to say, I've had to use modalities for time management.
It's almost just what you have to do,
time,
right?
Like,
you're not going to survive if you don't.
Not ready for them yet. Can you do a 5-minute ultrasound?
Yeah.
Like that's just what we were doing, and like that's definitely something I would dissect a little bit, especially going back to the start of this conversation when they go, I've tried PT and it doesn't work, right? It's like, okay,
what
were
are
you
those
just
sessions
going
look like?
heat for 10 minutes, ultrasound, riding a bike, and then going on some ice and eat electric stimulation?
Right.
Like, okay, yeah, it didn't work for a reason at that point, right? So I think it is good to go back and review that. And I think that is something for a patient to continue to review the kind of treatment you're getting after that initial interview, that initial evaluation of seeing like, okay, am I still on the same program? I just met up with an old friend. I've known him since preschool. He's an ER doctor in Santa Cruz. And he told me about a recent ankle surgery he had. And he said he was in rehab for 10 months. So talk about the autonomy and stuff. He knows exercise-based stuff.
Not just doing his home program for 10 months. He was going to the clinic for 10 months.
And like, I know, I'm not going to say the condition, but it's not a 10-month rehab kind of thing. And so like, that's the other thing is to see what kind of autonomy you get from, and that comes back to the education part. Is somebody going to educate you and not try to keep you going? They're going to teach you
how to manage it on your own, get more independent, give you the tools that you need to work on it on your own.
Yeah.
Right? There's always something to be gained from having a PT there. There's something you can learn, whether it's cueing the form or just a bit of insight or knowledge that you gain. But at the end of the day, if we're getting people to be dependent on us just so that we have returning customers and it's good for business, at that point, I think we're thinking a little bit too much like a business person and not enough like a healthcare provider.
Definitely.
Like we want to be empowering people to lead healthier, more active lifestyles on their own.
Yeah.
And so I have to say the bike is a really touchy one for me, because I know people who maybe like the bike is not what they need in order to treat the cause of the problem, and the therapist walks away when they're on the bike and does something with another patient while they're on there. So it can be kind of used in that model. On the other hand, though, like we said, our bias is exercise and strengthening and movement, and the bike may not be necessarily strengthening, but it's definitely exercise, and that's huge for so many things, whether it's good for your brain, it's lubricating your joints, it's getting your tissues warmed up, it's getting blood flow and lymphatic drainage, which is how your body gets inflammation and other metabolites away from injured tissue. And so it does so many things. It desensitizes you. And also then if you have like diabetes, or if you're overweight, obviously the bike is good for that too. You're burning more calories, getting your heart rate up, lowering your blood sugar, making your brain more focused and perform better after. So I'm a huge fan of doing the bike.
Yeah.
But if someone really needs to get stronger or learn how to do some sort of coordination that's different with their body part, and they're spending they have 20 minutes with the therapist and 10 of those minutes are on the bike, it's just not the most effective use of your time. And when it comes down to it, I think a lot of these things is, if I had all day, I would massage you and work on your joints and use the machines and the lasers and the taping and the exercise and the stretching. But people don't have 8 hours a day unless they're like an Olympic athlete, right? If you only have an hour with someone, or even worse, if you only have 15 minutes with someone, like I'm damn sure not going to be ultrasounding them for 10 out of those 15 minutes if that's all that I have.
Definitely.
So it's not to say that there's not a benefit there, but a lot of times in the real world, you have to pick and choose, how do we use my time most effectively? And I think it's going to be educating. That's the one treatment that all patients, I think, should get, is educating. And then most of them are going to get some kind of like movement intervention, whether you're getting them more active or you're strengthening or you're working on their mobility or their coordination. It's going to be something like that. And then those other treatments I like to use in certain situations, sprinkle them on top, maybe use them temporarily until they're feeling better and that sort of thing.
Definitely, yeah, I agree with you. I use the bike all the time. I wasn't trashing it in the sense of it's a bad modality to use. I love the bike.
Oh, it's a great modality.
Yeah, I think it's
just shouldn't be the whole session.
And I can show somebody how to use a bike, set themselves up in one session, right?
Right.
So like, that's fine. If that's all they're doing though, if it's like a heat, passive modality, bike, and then
if you need to touch base with them anyway, they may as well be moving while you're getting their report.
I used to love doing a report when I was in clinic, doing that with the bike, and I think that's a great.
I would do that all the time, but I would try, unless I got backed up because of the model and being really busy, but ideally I wouldn't have a patient on the bike and I'm just working with someone else while they're on the bike, right?
Definitely. So let me ask you a question regarding autonomy. I think that's an interesting topic, right? I see all the time on social media PTs going back and forth of, you need to release the patient and not have them be dependent on you, right?
Yeah.
Now, we're starting to branch into other areas. Physical therapists are, right? Everybody knows us as post-injury, post-op, all these things, right? And now we're starting to go, okay, well, we have room for training, prevention, wellness, a lot of different things, right? Triage even, first responder. Now they're kind of being first point of contact in the military, right? So like we're starting to become, we wear a lot of hats, I guess what I'm saying. So
absolutely.
I do have some patients right now that I have been with for, the 10 months or 11 months or 12 months, and it's transitioned into like a training kind of program. And, some people might say, okay, they rely on me and, I'm not giving them that autonomy. But I also is there something with the wording that you tell a patient of not saying, hey, you need me to realign your back, but versus saying they know that they can do this without you. You've educated them. Right. They feel strong to do it, but they like having you come in. It's a motivating factor. Is that something that is a little less controversial? Is that something that you think we can do also?
I don't think it's controversial. I think the only thing that would be controversial is if you're billing insurance and claiming that it's medically necessary for that person to be functional with their daily activities. If you need someone to see you, and I have people say, I've seen this chiropractor for 15 years, once a week, they're great, and my back still hurts, It's like, well, if after 15 years, if it hasn't solved the problem, it's probably not going to solve it in the next few visits or whatever like that. So I don't think we need to think about it in that same way. I think that so all of the body systems, they work together, but they don't function in isolation. And so when you think of having a neurologist and an orthopedist and a GI and all the different specialties, I think it gets us to look, again, we might, in PT, we might say, just look at the knee or just look at the shoulder and not look at how it's connected to the spine or the elbow. And I think in other aspects of healthcare, they just look at one body system and not how it interacts with the others. But we're learning more about the interconnectedness of all the systems. So I think that the best people in all the different healthcare disciplines are going to be meeting a little bit more toward the middle and doing a little bit of everything. So I think that there's absolutely value in a physical therapist bridging the gap between that and being just a really, really highly educated and trained personal trainer.
Yeah.
Because a lot of times that's also a transition that people struggle with. I'm getting better in therapy, but now how am I going to do on my own? Compliance is a huge issue. Just because they might have the knowledge, they still really need somebody to keep them accountable, or they need some help fitting it into their lifestyle and making it a habit.
Yeah.
And I think that it's totally legit for us to provide that benefit by showing people how to progress over time, helping them with their lifestyle, keeping them accountable. And even once the pain goes away, there's still things to work on, right? As soon as the pain goes away, it doesn't mean that you've completely fixed the cause of the pain that led to it. You just got it good enough that the pain isn't presently there. So I have no problem with PTs stepping into those roles. I do nutrition counseling. I do some fitness and performance training. But I just don't tell the insurance this person needs therapy for over a year in order to treat their knee sprain or whatever it might be like that.
Definitely.
I think that that's something that as we get away from the insurance-based private practice, a lot of people wanting to be seen, not enough time to see everyone. I think that's ideally a lot more of how it should work, is that there's more interdisciplinary collaboration, and that we're looking at the person's health and lifestyle and not just at the mechanics of one joint. So actually, I don't have any problem with that. I just have a problem with doing things intentionally to try to get people to be dependent on you.
Yeah.
Like, oh, I need that massage twice a week or else I'm not going to feel okay without it.
So it comes back to the language used and the education of around intervention, right?
Exactly.
So let me, one more question. I know,
Please.
With the compliance part, since we're kind of talking to a patient population here, are there certain things that you've seen with patients that help them be more compliant? You know, like I'm sure a lot of people, I lack, there's times I'm like, I don't want to go to the gym, or I don't want to go play soccer or surf.
All do.
Or, you know,
we all have one of those days.
So are there things that, like, kind of what I heard in that last statement was maybe even doing check-ins here and there, right? Like every 2 or 3 months you have a check-in with your therapist and just see like, hey, am I still on the right plan, or I'm having some problems progressing, or whatever it is. Do you think that might be a tool to help with compliance?
I do. I think that can be a good thing for the future. You know, we go and see a dentist twice a year, and they clean you when you're there, but it's also a checkup just to make sure, and they're reminding you to stay on top of your dental hygiene that you're supposed to be doing every day on your own when you're not seeing them. So I definitely think that can be a useful model, and sometimes you might see someone weekly or twice a week, and then you can see them a little bit less often as they get to be more and more independent. But that's really the best, the most important thing is the compliance, right? Any treatment plan done consistently works well. The best treatment plan done inconsistently is not going to work as well as any run-of-the-mill treatment plan executed consistently. So that also kind of takes me back to patient-centered care. Is like your physical therapist should be trying to personalize the treatment for you as an individual. So there's a popular coach named Stan Efferding. He has this saying I like: "What's the best diet? The one you'll follow. What's the best exercise? The one you'll do." And then he goes, "Compliance is the science." And I could not agree more. Compliance is the science. Maybe you know that the research says this one exercise is the best for activating this muscle, but you know what? For that person, it's either not fun or it's really uncomfortable. It doesn't feel quite right. They're just not sure if they got the hang of it on their own. There's always options. Let's find the exercises where the patient feels like there's meaningful or some value, or they feel it working. And so I'm regularly checking in about my patient's home program. Like, is it too much to manage? Do you think you could handle more? Is it a little overwhelming? Because maybe there's 6 exercises that would be really great, but they'd be better off to do 2 exercises consistently than half-ass 6 exercises and not even get to the last ones, or they're just rushing through them. So I might think that it would be better if they did 6 exercises, but if they find 2 that they really connect with, that they really feel like are helping, like I'm going to go with that. And then maybe in the future, after a month, we'll add a 3rd, you know, instead of just me always saying, you got to do these 6 and it just never gets done. So I think that really has to be personalized. Is like, what is it going to be easier for this person to stick to? And it either has to be enjoyable. Like, you're not going to do anything forever if it's not enjoyable. But maybe you'll do it for a fairly long time if it's at least meaningful and you understand how it's going to help. But then I want people to get to do also, like, eventually get back to like their sports and recreational activities that they enjoy as a way to stay active. Because I like lifting weights. You probably like lifting weights too, but it's not always the most entertaining for everybody.
No, for sure. And so it kind of sounds, one of the things we might have left off a little bit at the very beginning of what to look for in a therapist is if they have time and they're willing to communicate with you as well, right? That's such a big thing. And when you go into clinic, you know, I was there, I was managing 3 patients an hour, 20 plus patients a day. I had 5 people there at once while I'm trying to take a subjective report and work on people that, you know, I wasn't exchanging information, cell phone or emails, of like being able to check in, right? And like monitor that. And I think that's such a beneficial thing if you find any provider that is willing to have that communication with you so they can alter things, change things. I have a lot of people that now check in with me with the mobile stuff. Of, you know, first point of contact, oh, my son sprained his ankle in soccer, what do I do, right? And like, to have somebody in your corner, I think, to offer those kind of solutions or give you some kind of triage, I think is something that when a therapist has more time, that goes into the overall well-being of your community.
Absolutely. I encounter a lot of times patients will come in and they will just say, just tell me what to do and I'll do it. Or they think that we just have like a list of the best exercises for something and we're going to give them those exercises, and if they do them they will get better. And that's not the fault of the patient, but they just don't realize how individualized what we do really is. So if anyone's listening, if your exercises are too easy or too hard, or you're not sure how they're helping or if they're helping, please communicate with that to your therapist, advocate for yourself. See if there's something else they can do, because they might have a really good idea based on a combination of research and their experience, but it still needs to be individualized. And so it's best if you let them know how it's making you feel, and maybe they will want you to still do the same exercise, but it's good for them to have that information.
Yeah.
I had someone yesterday and I accidentally flared up his hip because he didn't tell me it was hurting throughout the entire exercise. He was like, this must be a good exercise for me to do. And at the end of like the second hard set, he was like, it's been hurting with every rep. And I was like, every rep? Why didn't you tell me before? We could have avoided that flare up. And so now he's going to have to let it calm down for a couple of days, and then we'll modify the exercise next time. But we could have modified it last time if we had just had a little bit more communication.
Yeah.
So it doesn't mean that your therapist isn't highly educated or very bright or has great experience. You still need to give them some feedback. So finding a therapist that you feel like you can talk to and they'll listen to you, they're not always in a rush out the door, is what you want to look for. And there are really good therapists who do still care about patients and individualized care, who work at these insurance clinics where you're seeing multiple per hour.
Yeah.
And they might be in a hurry sometimes, and it's not because they're not listening, and it's not because they don't care. But I think that as a patient, you can kind of tell when someone is just hurrying you through the door to make the day go by, or if they're really just late because they're in a high volume setting.
Yeah.
But that's the biggest takeaway, I think, from today, if we can kind of summarize, is you need to have some face-to-face time with your therapist. Even if you have excellent aides and assistants, that's great, but it's not quite the same as having it with the therapist yourself. So how much time are you getting with your therapist? Are you receiving an education when you go in for therapy? Are you just going on machines and they're doing stuff to you and telling you what to do, or are they teaching you how to take care of it? What does the pain mean? What do I need to work on? How should the exercises feel, and things like that? And then is there some kind of movement or exercise or physical activity going on in the session?
Yeah.
Would you say that's a good summary of what people should look for? Is there anything that you would edit or
the last
add?
one I would probably add is, again, the communication part. If there are options to be able to communicate with your provider in any way, I think that is so beneficial for just keeping you on track, right? Like, it shouldn't just be over when you're done with therapy, right? I think the check-ins are great. I think, again, PTs are expanding to wear multiple hats now, that we can be relied on for that kind of stuff to keep somebody on track, make sure they're doing the right stuff for their body and their health. And so that's the last thing I'd probably add, but the rest sounds great.
Awesome. Yeah, always asking patients, like, I'm going to ask you next time how you felt after this one, right? Yeah. And if it was too much, we're going to do less. And if it felt good, we'll do a little more next time.
Yeah.
Awesome. I think that's going to be really useful for the listeners, so they can know how to evaluate physical therapy and make sure they're finding a good therapist, whether it's at the same clinic or if they're going somewhere else. And there will be a trade-off, of course, if you're in a place that has an hour kind of session model or a 15, 20, 30-minute model.
Yeah, those are unicorns, by the way, now.
Yeah, the hour sessions.
Yeah, they don't really...
Or they're just like cash-based. They're not on insurance, which is a whole other conversation that maybe we'll save for next time.
Yeah,
is the value there for these concierge or cash pay kind of visits and sessions compared to the insurance model?
Yeah, that's great.
Thank you so much, Jeff. Is there anything else that you want to share with our listeners before we wrap this up?
I don't think so. This is great. Yeah, if you ever need any assistance from us, I know AJ sees private pay patients. We have a company, Bridge to PT, that we go at home or work again, and we're here as a resource too. And yeah, don't ever hesitate to reach out with any questions.
Where can people find you or follow you?
You go to bridge2pt.com. All of our stuff
number
is
two, right?
The number 2, bridge2pt.com, and we have a list of all of our therapists on there. So it's the other thing that with the clinics is a lot of times you get assigned a therapist. Our model lets you handpick a therapist based off a biography that you feel matches what you need. Then complimentary consult calls to see if that fit is good before you even start. So yeah, you can find us at bridgepd.com, and we have a little box that if you ever have any questions, don't hesitate to reach out.
I think that's a pretty unique thing, that people can actually see what their therapist, their philosophy and experience is before they even make the initial appointment, instead of like, we'll see who I end up with and maybe I can transfer if I don't like them.
Yeah.
But you can actually look at their bio before you even make the appointment. That's pretty cool.
Yeah, and there's something about like a consult call where you get to feel, it's not like about your injury necessarily, it's about feeling out the
Make
relationship
sure you're the right fit.
and see if it feels like a good fit, if it just feels right. So I think that's a beneficial thing. Again, if you do go in clinic, it's kind of nice if there is some kind of complimentary consult that you have a little bit of time with somebody before you start with them to see if it's a good fit.
Absolutely. All right, Jeff, thank you very much.
Yeah.
There's a lot of things that we kind of teased or hinted at that I think could lead to a whole other can of worms. So I would love to have you back on for another episode at some point.
Yeah, it'd be great.
Thanks for your time. Good speaking with you.
Yeah.